Welcome to Global Dispatches, a podcast about foreign policy and world affairs. I'm your host, Mark Leon Goldberg, editor of UN Dispatch. And in this show, we discuss topical global issues, have conversations with foreign affairs thought leaders and newsmakers, and give you the context you need to understand the world today. Go to globaldispatchespodcast.com to learn more. And now on with the show. We have known for years that vaccinations, including routine childhood vaccinations for diseases like measles, mumps, and rubella, don't just save lives, but they prevent children from dying on a fairly massive scale. We also know that as a health intervention, most vaccines and vaccination programs are relatively inexpensive. What was not well known, at least until recently, was the relationship between vaccine-preventable illness and poverty. My guest today, Dr. Angela Chang, led a groundbreaking study that offers some clues and useful insights to suggest that vaccines and vaccination campaigns can be an effective tool to prevent individuals in the developing world from slipping down the income ladder into extreme poverty. Dr. Angela Chang is a postdoctoral fellow at the University of Washington's Institute of Health Metrics and Evaluation. The study was published in the journal Health Affairs while she was a doctoral candidate at the Harvard School of Public Health. The study is titled The Equity Impact Vaccines May Have on Averting Deaths and Medical Impoverishment in the Developing World, and we kick off our conversation discussing what we mean by medical impoverishment before having a longer conversation about her findings. Here in the United States, several states are in the midst of a measles outbreak. There's an outbreak in the Philippines currently and in Eastern Europe, and there's some localized outbreaks as well. These are mostly caused by parents opting their children out of routine vaccinations. This conversation, I think, kind of brings home what can be gained from participating in routine vaccinations, including averting your child's death and averting them from getting sick and plunging you into poverty. Needless to say, vaccines work, vaccines save lives, and now we have good evidence to suggest that vaccines also help prevent poverty. So here is my conversation with Dr. Angela Chang of the Institute for Health Metrics and Evaluation.
So medical impoverishment, very broadly, is defined as people becoming impoverished, so people going into poverty due to out-of-pocket expenditures for medical care that they seek. So this is a common definition, and it's fairly prevalent in many parts of the world, actually including the U.S. So it's not just a issue of in countries that have lower income. So it's across the world, and there are studies that the WHO, the World Health Organization, and others have done to try to estimate what the impoverishment due to medical care is, and it's fairly high. I think it's depending on countries, but it could be like 20-30% of people who go into poverty are due to medical care.
So what inspired you to sort of take a look at the link between medical impoverishment and vaccinations?
So we started out more of an interest in vaccines themselves. So vaccines, many people know, are beneficial for health outcomes. So it prevents a lot of diseases. But my team, along with other partners, including Gavi, the Vaccine Alliance, and the Bill and Melinda Gates Foundation, we were interested in learning about what other benefits vaccines may have in addition to health benefits. So we were interested in two things. One was, do vaccines, because vaccines prevent diseases, does that also mean that it prevents medical impoverishment? And then two, what are the distribution of benefits of vaccines, both health and economic benefits of vaccines that are distributed across different income groups?
And so that's basically what you set out to measure, the sort of how you would quantify whether or not vaccines can reduce sort of medical impoverishment, and also who vaccines help prevent from becoming medically impoverished.
Correct.
So how did you go about measuring that data and finding that data, and just talk me a little bit through your methods?
Sure. So data for both of these that I mentioned don't exist well, they exist in real life, but people don't really collect them. It's hard to collect data by income groups, for example, or immediately attribute poverty to medical impoverishment. So a lot of this had to do with modeling. Ideally, empirical data existence of empirical data will be great. And that's what Gavi and the Gates Foundation are trying to do next. But because we don't have them, so we had to rely on modeling. So we kind of thought through what causes people to have diseases. So what are the risk factors what are the risk factors of people getting a disease, whether the people get vaccination or not, and then whether people get treatment if they have the disease. And so we have data on these things. And so we tried to put them together and created a model to estimate what it would look like by different income groups, how before and after the vaccine, how the diseases are spread.
So what sort of like inputs do you use in this modeling?
So the main inputs came from the Demographic and Health Survey, which is a data source that many people in our field use. And it's a survey, a household survey conducted in many, many countries. We looked at 41 countries that had the more recent DHS data, and that included prevalence on risk factors. So, for example, and we looked at 10 diseases. So the risk factors of these diseases include malnutrition status of children, water sanitation status of households by different income groups. So we knew, for example, in one country, 80% or maybe like 40% of kids in the poorest quintile were malnourished versus 10% in the richer quintiles. And so we had different distributions of these risk factors by different income groups. We also had vaccine coverage rates, current meaning at the time of the survey, as well as projected that Gavi did by income groups. And if the children or people who were sick whether they received care or not. Mm-hmm. So these came from a bunch of different sources, but mainly from DHS.
Okay. And so what did you find in terms of how vaccines both prevent deaths and also prevent medical impoverishment?
So the death part at the national level, we know that vaccines are impactful, right, in terms of saving lives and reducing morbidity and mortality. So that's clear. What was new in this study was the impact across different income groups. So we found that the poorest households would likely receive the most benefit from increased access to vaccines. They currently already benefit the most, mainly because the underlying risks that they have are much higher than other people. So an example, because they're more malnourished, they are more likely to benefit from vaccines because it prevents more cases that could have happened. And so that's one big finding, that the poorest households tend to benefit more. And right now, even though the poorest quintiles have lower vaccine coverage rates, they are, by absolute numbers, they are benefiting more because of high risk. So the implication of this is that if we target more, we can target vaccine coverage rate improvements in poor income groups, then we will save more lives or reduce mortality and morbidity.
Is there a particular vaccine that your modeling suggests is most effective or more effective at reducing medically induced impoverishment?
So yes, I think measles was one of the biggest actually, so a couple of things. One, so it depends, your question depends on like how effective the vaccines are, for example, as well as how costly that, if you get that disease, how costly that treatment is. So the big ones are primarily cancers. So hepatitis B, vaccine which prevents liver cancer, and HPV, human which prevents cervical cancers. These are cancers that are expensive in the longer run, and therefore you tend to prevent more medical impoverishment. The other ones are diseases that are just more prevalent, so measles and meningitis.
Oh, that's interesting. So it's both like the most prevalent ones because they just have like the widespread effects, but like measles, but are relatively, inexpensive to treat, but also the really expensive but perhaps less prevalent ones that cause cancer, like HPV and Hep B.
Yes, correct.
Oh, that's interesting. So, like, how did you figure out, I suppose, like, what would cause a medical induced sort of incident of forcing someone into poverty? Like, how do you sort of model that?
So we had to rely on a couple of inputs. So one is just the distribution of household income in different countries, how close they are to the poverty line. So we used the typical World Bank poverty line, and we did a simulation where if a household gets hit by the disease, how much that might cost the household, how likely they are to go seek care, and then given how close they are or not to the poverty line, how likely they would fall below the poverty line.
Can you maybe like walk me through an anecdote of like how a sort of disease or vaccination against the disease might prevent like a family from falling into poverty, and sort of based on your research, like how vaccines might sort of prevent poverty, medically induced poverty. Like, are there any? I guess what I'm trying to ask, are there any like stories you can tell that might elucidate, might make this data sort of in this research sort of feel real to a listener?
Sure. I'm trying to think. So, for example, the HPV vaccines are considered highly effective in preventing cervical cancer. So, in fact, what I understand is that cervical cancer that's induced by HPV virus, I think, is the biggest, if not the only, risk factor that determines whether the person gets cervical cancer later in life or not. And cervical cancer is very, as with most cancers, are relatively expensive to treat. And so if a girl, I believe the age is adolescent or even younger, boys and girls actually, received a vaccine early on, they are much less likely, if not at all, to get cervical cancer later in life, and therefore prevent that cost that the household, he or she may have to pay later on. And that money could be used towards other things that are important for the household.
I'm wondering if like one implication of your research is, if you're a government and you have limited resources, or you're a donor and you have limited resources, if you want to prevent the most number of deaths, perhaps you invest in measles vaccine. But if you want to prevent the maximum amount of medically induced impoverishment, you invest in like the HPV vaccine.
Mm-hmm. Yes, correct. So that's one of our conclusions. I think right now in the public health community, in the past, we've mostly focused on health outcomes only, and rightfully so, like reasonably so, we've been focusing mostly on health outcomes. But I think there are more movements right now in global health towards not just thinking about health, but also poverty and the broader social determinants of health. And poverty is a big one. And so, for example, the World Bank is talking about eliminating poverty, and others as well. Or the recent movement in universal health coverage is not only about health, but also financial protection, exactly to prevent medical impoverishment. And so this paper gives a good, the fact that vaccines are good for health is not new. What's new is that vaccines can not only prevent medical impoverishment, which is a big policy implication on its own, but it would also reduce inequalities in health because it benefits the poor more.
I mean, so that's yeah.
So,
yeah,
I mean, when we're asking, what we're trying to promote is to think for policymakers exactly what you were saying earlier, like when you're setting priorities on what to invest given limited resources, is health the only thing that you're concerned about? If there are other things that you're concerned about, there are other aspects such as these non-health benefits that one can consider and use vaccines as a powerful policy or mechanism and intervention to improve health equity and reduce poverty.
Well, and that's what I find your study so interesting in the context of the Sustainable Development Goals, which, are all about you can't take one goal in isolation. They all have to sort of work together towards this grand sort of end state in 2030 when inequality is reduced, health is improved, poverty is eliminated. And I just find, and I found your study so interesting for precisely that reason that it sort of like takes out of the silo the the vaccines from their specific health outcomes.
Mm-hmm. Yeah, and I think this also fits into a broader movement, at least in the vaccine community, about looking at non-health benefits. So we looked at economic benefits, but there are other non-health benefits that vaccines can provide. For example, development, cognitive benefits. By reducing diseases, kids are less likely to miss school and therefore have better educational attainment that affects them cognitively, economically in the future, and so on. So there are more movements like this in the research community that are trying to move more towards the broader picture of determinants.
What's the cutting edge? Like, what's the next sort of frontier of research on, vaccines and their social impact?
So one is actually getting empirical data. So we are now relying still a lot on modeling. And so I think actually having good data that you can track over time by different subgroups would be nice. For us, we focused on income groups, but there are many things that other subgroups that we might be interested in. For example, by subnational regions, by sex, as you mentioned, by different groups of people. And I think having different subgroups would allow better policymaking. So income groups, for example, are useful to know, and income groups are maybe kind of overlaps with geographically how you design policies, but it's probably not the most straightforward way. So if you can have by neighborhood, by subregions, that aligns better with policy design, is the next goal. I think just the general, more broader benefits that are beyond what we just mentioned is the next goal.
Is there any other aspect of this paper or your research that you think is sort of worthy of highlighting in the context of this conversation?
I would say so, not specifically this paper, but this paper is also accompanied by two other more methodological papers. And one thing we do is different scenarios. So what if, given the exact same dosage that a country is projected to use in that year, if we redistribute them differently, how would it look like, or how much more benefits we might get? And of course, every country is slightly different because of their baseline, their risks, and vaccine projections, and so on. But the best scenario in most countries are where you specifically target poor groups, so groups with higher risks, and it's logically it makes sense, right? So because they have higher risks of getting these diseases, they are less likely to receive care when they actually have the disease. So if you target vaccine coverage rates there, you would gain the most in terms of health and economic benefits. And also this group of the poor groups are the ones that tend to fall under the poverty line when they receive care. And so disproportionately benefiting the poor is the most effective policy. But that being said, this study doesn't look at the cost of these policies, right? So targeting the poorest groups makes sense, but it could be the most costly policy that the government could have. And so there's always a trade-off, and we don't really look at that in our study.
Yeah, like it's more expensive to reach the harder to reach people than it is to reach, perhaps maybe populations that are like non-nomadic or they're in cities or something like that.
Correct.
Well, Angela, thank you. This is really interesting.
I'm glad.
All right. Thank you all for listening. Thank you to Dr. Angela Chang. That was a helpful conversation. This is actually one of my favorite genres of episodes, is where I talk through like a scientific paper in ways that I find understandable and useful and have some real important public policy implications as well. I've made this announcement before, but if you're listening to this contemporaneously, I want to let you know that we have spots available for advertising in the month of March and in April. Please send me an email using the contact button on globaldispatchespodcast.com if you're interested in securing one of those slots. I'll tell you about our rates and our reach and our impact. All right, see you next time. Bye.